Now, coronavirus is the biggest health crisis that the world has faced in many decades. Well, the biggest worries this pandemic has caused in a continent like Africa is the adverse impact that the virus has had on the normal health services, such as vaccination amongst children. A new study by Lancet has found that the importance of continuing vaccination far outweighs any potential risk of getting infected with COVID-19 while on a visit to the hospital. Now, the Lancet study has also considered the impact of COVID-19 pandemic and the lockdown on the immunization for diseases such as tetanus, hepatitis B, influenza, pneumonia, measles, meningitis, yellow fever, amongst others. The study has also said that children can be infected by either vaccinations or during transport. It also takes into account the impact on households if the child gets infected while on a trip to the hospital for vaccinations. Now, the medical journal claims that it applied country-specific household age structure estimates and also age-dependent infection fatality rates to calculate the number of deaths attributable to the vaccinations. Now, the findings are crucial not just for vaccination drives in Africa but also for children across the world. The study has found that even under the shadow of the pandemic, during a 6-month period of 2020, regular vaccinations in Africa will prevent nearly about 700,000 deaths in children from the time of vaccination until they turn 5. About a third of these averted deaths could still occur due to measles if regular vaccination is ignored. Nearly about 471,000 deaths could be averted after the EP1 immunization against hepatitis B, influenza type B and pneumonia. Now, immunization against measles, meningitis and yellow fever is estimated to prevent nearly about 230,000 deaths. Now, all these are figures of lives that could be saved among African children from the time of vaccination till they turn 5 years old. Some fatalities will happen. Close to about 8,300 deaths may occur due to exposure to COVID-19 related hospital visits. However, the benefits reportedly far outweigh the risks, as more than 700,000 lives could potentially be saved once immunization is done against these diseases. The writing is on the wall. The facts and the findings are crystal clear. No country in Africa and the world can afford to ignore regular vaccination amongst children due to a possible threat to the COVID-19 infection. The more than 700,000 children in Africa alone can be saved. A third of these children can be potentially saved in countries like Nigeria, the Democratic Republic of Congo, Ethiopia and Tanzania. The more than 14 million people worldwide are infected due to the coronavirus. The pandemic has claimed over 600,000 lives already. However, the threat of the coronavirus cannot supersede the importance of getting a child vaccinated against other killer diseases. Now, we have a cure against most diseases and we must use it. Meanwhile, the world's leading scientists and medical care experts are racing against time to try and find a cure or a vaccine for COVID-19.